I was asked to speak just a little bit about the Ideas Initiative that's happening in the School of Public Health. You've probably heard it mentioned a couple of times over the course of the day, but normally a faculty member, what do? I teach a couple classes, I do some service, I do some research, right? But I had this opportunity, and thank you, Dean Bowman, wherever he might be, for this opportunity. Believe it or not, the School of Public Health, our faculty voted on 4 critical issues that are facing the United States and the broader populations across the world. One of those issues was firearm violence, and they asked me to help sort of galvanize the enthusiasm, the excitement, to bring all the minds within the School of Public Health to try to get people aware, start working together. It's been a theme that we've heard all day long. It started with Dr. Cunningham. Dr. Zimmerman mentioned the same thing. It's not just something that epidemiologists are going to solve on their own. It's not just something that biostatisticians are going to solve on their own. Health behaviorists like myself. We need to pull in all of the different resources that we have, nutrition and the built environment folks at EHS. Each of us have something to say. Health management and policy. Are you kidding me? We're talking about hospitals. We're talking about administration. We're talking about the policy work that Dr. Zioli is doing. All of these different voices coming together around this common issue. And that's what's so exciting for me. We, as part of the initiative, this was funded by the Dean's Office. We have a couple of years to really start to move the needle in this space, and we're looking at 4 different sort of areas that we're hoping to influence. And it starts with research. What can I say? We're at the University of Michigan. We're a research institution. It's what's going to help us inform this conversation. So we are trying to get faculty to be excited about the kinds of research opportunities that weren't there 10 years ago, that certainly weren't there 20 years ago, but that are possible now. And so can we create some of these collaborations? Can we apply for some of this funding and move some of this science forward? How exciting is that? I actually think that's pretty exciting. Again, because it is so central to what the University of Michigan is, right? We are a teaching university, but research undergirds so much of the work that we're doing. But don't forget about that teaching aspect of it, the training component, right? I don't just do my research in my little office and call it a day. No, I get to talk to undergraduates. We have an undergrad program in the School of Public Health. Did you know that? Did you know we have an undergrad program? I get to talk to graduate students, our MPH students. I get to talk to our PhD students. Several of my PhD students are in the audience right now. I get to talk to postdocs, all the way up to even senior faculty who said, you know what, I've never really looked at this space before, but I got a skill set. I think it could apply here. What can we do together? So creating some of that, again, awareness, creating those opportunities to engage in that space. And so much of that starts with education and partnering with the Institute too in terms of the different ways that we can provide opportunities, be them internships, be them independent studies, be it showing up in classes and talking about some of these things, because so often gun violence does sort of get pushed to the side, or it's not necessarily kind of a central, if I'm thinking public health, this is what I need to be thinking about. But I think we can all recognize that gun violence is a public health issue. Outreach, another theme, and it's going to certainly be reflected on this panel. We're not just going to do it in the confines of the University of Michigan. How are we getting this information out there? The worst thing I could think of in the world is to do a whole bunch of good science, to do a whole bunch of good training, and have it just live at the University of Michigan. It's not finding its way out into those that are affected, right? How can we disseminate this information? How can we translate some of that science into things that are actionable, usable for, again, those communities affected? And as much as I love my colleagues here at the university, what voices are we missing? We're missing the voices of those communities that are affected by gun violence. And as far as I can tell, there is almost no community, unfortunately, across all the different things that you might think of that is immune from gun violence. So all of those voices need to be represented. We're trying to engage those voices, trying to make those messages as credible as we can, as trustworthy as we can, as actionable as we can. And then finally, how do we keep it going? Right? The second worst thing I could think of would be, we do all this great science, we engage with all these folks and voices, we have some good ideas, and then it just sort of stops. So I put development up here, and at first I thought that's funding, right? Trying to get the NIH grants, the CDC grants, et cetera. Yeah, that's a piece of it. But what other kind of development are we talking about? Capacity building. So it's things like skill development, leadership development. Workforce development. I see there are MPHs in this audience that are doing this work, right? We are training the next generation of professionals that are going to be working in public health spaces. And if they have this idea that gun violence is pervasive, that it is going to affect their work in some way, shape, or form, I promise you I can make that connection. Because gun violence is so prevalent, because it affects so many different communities, and that our next generation of MPH and all the folks that are going to be working in this field are exposed to this material, and we are developing that capacity so that they can continue this work moving forward. We have had a very successful year at the research showcase following this event. We have a poster where we talk about some of the pilot studies that we funded, some of the events that we've held, some of the partnerships that we're developing. I encourage you to please take a peek at it. But before I turn to this panel, I just have to thank Julia Bell, Brent Miller, Allison Grzinski. They meet with me every week and they think critically about this. They help me engage faculty within the school. They help me engage faculty at the Institute and other folks that are working in this space. And without them, this wouldn't have been possible, including this event today. So can't thank folks enough. Can't thank Dean Bowman enough for making this investment and allowing us to help move this critical issue forward. So that is the second. If you want to learn more about what we're doing. I didn't have one of those fancy graphics that Mark had, but you send me that email, I'll respond to that email. And folks, the calls are out. The DOJ calls out, the CDC calls are coming out. This is the time where we can start creating those collaborations. This is the time where we can start making some of those steps towards meaningful intervention, et cetera. So, all right. It is now time for our next panel, and I'm so excited. I know all the folks on this panel. This is going to be a good panel. I'm going to invite everybody up to the stage. I'll start with Charlie Branas, who's the chair of the Department of Epidemiology at the University of Columbia. Next, we have Hsing-Fang Hsieh, who is a research assistant professor at the Institute for Firearm Injury Prevention, the co-director of the Training and Education Core at the Institute for Firearm Prevention, and near and dear to my heart, the evaluation director for the National Center of School Safety. So. And then I'm happy to welcome Derrick Jackson, who is the director of community engagement for the Washtenaw County Sheriff's Office. And last but not least, Rebeccah Sokol, Assistant Professor of Social Work at the University of Michigan and Co-Director of the Training and Education Core at the Institute for Firearm Injury Prevention. Dr. Sokol. All right, so we actually had lots of questions submitted from the audience for this panel, which is great. You're making my job easy. Thank you very much for that. I am going to take that first question, though, and it's going to be around, I think, I'll ask each one of you individually, what has drawn you to this work in the first place, and what keeps you in it? Thinking about that sustainability question. So, Dr. Branas, if I could start with you. You're a pioneer in this field. I'll just go ahead and say that. And I know this work hasn't always been easy, but what drew you to it and what's kept you there for the last, 20 plus years?
I think my origins in this were as an EMS provider. And I basically was seeing patients and families over and over again. And I began to wonder, was there something more that I could do other than seeing them in the streets and in their homes? And I had the privilege at the same time actually to have a background in mathematics from a fantastic college. And I used that, the combination of those two, which was my entry into the fields of public health and epidemiology. And I do say privilege, and I'm going to try to answer your second question. One of the things that drives my sustainability and interest in making this even bigger than what we have today, which is bigger than I could have ever imagined 20 or 25 years ago, is to really think about that privilege a bit more. And think about not only as universities and as scholarship and hospital systems and so forth, what do we owe our communities? What do we owe each other? And in fact, what do we owe democracy? And I'm moved by the comment that was made this morning about the Peace Corps being here. And I had to look that up. I thought it was, wow, right on the steps here of the Union. And, to those who much is given, much is expected in return, to borrow some language from the Peace Corps. And that is what motivates me. I think we have an incredible opportunity as universities to step out of our spaces, to liaise with communities in really important bilateral ways that could change things for the crisis, the massive, historic crisis of gun violence that we're experiencing in the nation. So I'm hoping our conversation will go into that a little bit more today.
Excellent, thank you. Hsing-Fang, so your background, you've studied chronic disease, you study youth resiliency. What's bringing you into the firearm space and what's kept you here?
Sure. Hi everyone, Hsing-Fang here. First thing I want to say, I'm public health throughout. So as a public health student since college, initially I wanted to study tailored behavior change and came to University of Michigan School of Public Health for that. And then I met my mentor, Dr. Mark Zimmerman here. He disappeared. Anyways, that got me into study violence prevention and youth resilience in the past 2 decades. That's all I do. And met wonderful faculty member here, learned a lot of things. And then pandemic happened. And then we see how it affects Asian American communities. And that really drove me thinking, well, with all my skill training, what I learned, what can I do for my own community? And throughout the violence prevention research, I have learned so many different ways how the structural inequity really affect different communities, so many communities in such a tremendous way. In our African American community, in our Latinx community, and now it comes to my own community. So what can I do? And I also noticed a surge of firearm purchase among the Asian American community, along with other community too. So that really got me thinking what I can do, and led me to start collecting data with my collaborators. And really thanks to, again, the faculty member in School of Public Health have guided me, including Professor Ken Westnagle, including Mark Zimmerman, including Hsing-Fang Hsieh, including Dr. Allison Miller, everyone. So it got me here. And I now work on more than one project that's focusing on racism against Asian Americans and how that could increase firearm injury risk. And I'm looking forward to discuss more with you all.
Excellent, thank you. And Director Jackson, I think most people see a direct connection between law enforcement and gun violence, but you think of it more critically in an engagement. It's more than deterrence. What drew you to this field and why have you stayed?
Yeah, I think, well, first of all, I'm a social worker, graduated from this great university, School of Social Work, who became a police officer. And I know even at lunch when I mentioned that to a few people, I got this strange look like, all right, what's the story behind that? And I think it is this trajectory, this kind of meandering journey I've been on. I grew up in a community not far from here. So when I think about why I'm so committed to this work, it's a small community, but hyper-violent. And so I just grew up in a neighborhood where I thought everybody knew someone who had been murdered. Interpersonal street-level violence was just a part of my existence. It literally wasn't until I came to school here in Washtenaw County that I realized, oh, that's not normal. And so I never had the physical wounds of being shot or stabbed, but I always tell people, like, I've got this, like, ingrained in my DNA and in my soul, like these wounds of growing up as a young person and seeing people and friends who I had lost. And when I say that, it's not like somebody who was in my high school who I didn't quite interact with, and I seen them in a senior picture and they lost their life, but like people that I played with every day. One of my best friends who lived across the street from me one day was just gone. A guy we called Peanut who was on my Boy Scout troop who was just gone. a kid who lived around the corner from me that I would hand the relay baton to every day in track practice was just gone. And so from a young age, gun violence and that interpersonal street level gun violence just impacted me. And as I got to school here and then got to think about some of the work that I wanted to do as a professional, something kept tugging at me and calling at me. I was a social worker at a homeless shelter for teenagers, and I just started to meet all the kids in our community who were really struggling. And lo and behold, this sheriff candidate has this idea that what if you could do what you do in your neighborhood around building community and helping keep kids safe? What if you could do that through a police agency? And I honestly laughed at him and thought he was a little bit crazy. I said, it's not possible to do what I do through policing, but I was wrong. And I'm glad I was mistaken, because what I get to do is like really bridge this divide between community and police. And so right now we are at this intersectionality of individuals who've been violently injured. 85% of the shootings in Washtenaw County, the county that you sit in now, are retaliatory in nature. So we know that someone who's been violently injured, they're angry, they're fearful, they're traumatized, and they are rageful, and they're thinking about, how do I retaliate against the person who did this to me? And so now we hire people from community, some in the audience, not to be informants, but to be like experts on community, to sit at the bedside with people to help deal with all that fear, anger, and trauma, to hopefully reduce the likelihood of retaliation. So at the same time, I'll just say the last piece of this, at the same time, the rate of law enforcement here at the sheriff's office solving homicides is 85%. It's a coin flip in most places around the country. And we like to say this work goes hand in hand. Traditional policing and solving violent crime, and police legitimacy and community really seeing that you are trusted and valued. This work of working at someone's bedside actually makes it easier for us as detectives to solve some of these crimes. So all this stuff goes hand in hand. And so that's really what drives me. And the last piece I'll say is I carry this book with me everywhere. This book has now 57 names in it since I started at the sheriff's office, of young, primarily African-American men in our county that have been murdered on our streets by gun violence. We're one of the safest counties in this state. Ann Arbor is one of the best places to raise a kid, but we still have these hot spot pockets of violence. And so what keeps me motivated is trying to stop adding names to this book.
Thank you. And Dr. Sokol, from the intersection of public health and social work as well, focused on trauma and violence exposure, but why firearm violence?
Yeah, so I am very excited to say I am not a pioneer in this field of preventing firearm injuries. And I think that's really exciting, because what that signals to me is that this is now recognized as a very important field of research, and you no longer have to be a pioneer to get into it. Rather, it's open for so many new researchers to come in and to leave their effect in this area. And so, my journey to this space, I was, originally just really committed to keeping kids happy, healthy, and safe. I thought I was going to do that through primarily looking at the child welfare system in the United States. And I still do some of that work, but then during my postdoc, Mark Zimmerman said, hey, what about firearms? And I was like, oh yeah, firearms are a really big deal, but I heard in grad school that I can't do that. And he's like, no, you can do that. And so it was just, I think, a great opportunity to start to get into this field and hopefully have, be part of this large research community and also large public community. Communities all across the United States are really working hard towards creating solutions to preventing firearm injuries. And so I think a really big reason of why I am here today and continuing to do this work is because there's just so much public support for this work and so much community work already happening in this space, which really kind of paves the way to have researchers help support what's already happening in communities.
Great, thank you. And our panel is on community engagement, and I know all four of you are actively engaging communities. I mentioned that there were lots of questions submitted through this panel, and this one rose right to the top in multiple different formats. And I love this imagery of the tent and which voices need to be under the tent, need to be included when we're talking about firearm violence. So maybe Dr. Sokol, we'll start with you, and then we can see if folks have to respond. How do you begin to engage communities, and particularly those harder to reach communities?
Yes, I think everybody who wants to be involved in the conversation should be involved in the conversation. And how that process works, from different from project to project, whether it be a research project or a community engaged project would differ. The thing I do think we need to be careful about when working to engage and work with multiple different sectors and stakeholders is this idea of responsibilization. So anybody who wants to have a seat at the table and wants to help come up with solutions and work towards this, they definitely should have a voice. At the same time, I think we need to be really careful about not making people responsible for this issue when it's really not their fault. And I think particularly about kids and the welfare of kids and making them responsible for solving an issue that they didn't create. And so that's kind of one thing I always try to keep in mind as I'm going about this work.
Director Jackson, I'm thinking about Washtenaw County. I mean, you have Ann Arbor, yeah, it's a city, but then you go out towards me in Chelsea, it's Manchester. I mean, that's very, very different. How are you having those conversations across a county like Washtenaw?
Yeah, I think part of it is just the narrative, doing things like this to have a conversation to let people know it's a problem, it's an issue. In most of Washtenaw County, it isn't necessarily like the street level interpersonal violence is not an issue, but then when you look at suicides of young people in the county, it's a huge issue. And so the eastern part of our county, we talk a lot about homicide and interpersonal violence. On the western part, we talk a lot about suicide, and there's pain all across the board. And so they might look different, they might be different solutions, but really coming back to this core piece of like, how do we take care of our young people? I'll just give one example of what we did here. The Community Violence Intervention Team is just a group of people that have individuals who have gone to prison for committing heinous crimes, who have taken a life, but now are doing great things in community. It has mothers around that table who have lost their sons to gun violence. It's got folks like me around the table and some political folks. And we all came to the table understanding that we wanted to stop gun violence and save lives, but just as many people as around the table, we had many different ideas of how to do that. So when you think about bringing community together, we had to learn together. And so we started literally reading a book together. We read Bleeding Out first by Thomas Abt. So we had common language and common statistics and common understanding. And then we started to move together and had a commitment to elevate community voice. Those closest to the problem are often closest to the solution. And so make sure they're the most important people in the room and provide a platform. And then everything we started to do, we started to really give individuals, like Brandon earlier, like how powerful was his story this morning? More powerful than, I love data, but more powerful than any data I could read was like listening to him craft and weave his story together that left an imprint on me that I had to tell him about. Like, I just won't forget that story. And so elevating those mothers' voices who've lost their sons to gun violence is just something we've done here locally. And I think that's one way to really engage community and get people from different parts of this issue to all be speaking the same language.
Dr. Hsieh, I mean, you're talking about a population that hasn't been engaged in this work as much, that is increasing in the firearm ownership. How have you been engaging?
Yes, certainly. I do really want to start from knowing and recognizing in a way that as researchers and as a community member, we all have our own bias. We tend to put people into categories. That's how our brain works. And for Asian Americans, for a long time, we've been called as model minority. We've been called as, we don't really suffer from violence. And it turned out this is a bias. It's not true. And pandemic happened, really showcased us how this community can be largely, hugely, extremely affected by firearm violence and also by the structural inequity that's happening in this community, right? But without working with communities in this community, then you don't have that voice come to you. You cannot hear from them because of our automatic bias in our brain, putting them into certain category. So only with, really learning and listening from them will this voice be brought up. And I'll give you one example from this project, how we started. As really during the pandemic, I myself see repeatedly on the social media within my community how they talked about the fear, how they talked about firearm purchase. And then my collaborator, Dr. Ziying Wu in Eastern Michigan University, have heard from her community partner in Burmese Center, and it's really actually from the gun shop in the nearby neighborhood, talking about they notice a lot of firearm purchase by Asian Americans out of fear. And they come to the Burmese Center, express their concern. And we took that voice in heart. And without doing that, it wouldn't lead us to what we're doing right now. So really, it is the community members who shape what we're doing right now. That's what I want to say. Thank you.
Dr. Branas, I would love your broader answer to the question, but I remember reading an article about you, and voices were angry that you were doing this kind of research, and thinking about engaging some of those voices that are resistant to.
Thanks for asking. So I appreciate that, and I have to say, I'm going to just echo and say that this entire event and what Dean Bowman has brought together and what the Institute have brought together is a great first step to echo what you said in engagement and thinking about how to build these bridges. Voices that are dissatisfied with the work we've done. And I think, I was saying some of my earliest experiences was with a study that I had done, and it was the first NIH-funded study on gun violence. And in fact, that study, we couldn't use the F word. Dr. Rebeccah said that before. The F word here is firearm. And we tried to shield that word in that NIH proposal. And in fact, that's what got it funded in some ways. But that particular study caused so much concern. By the way, scientifically, it's been held up as a model study of its kind, a best-in-class study. So there's nothing scientifically challenging with it, but it was, at the time, made the cover of the American Rifleman on behalf of the gun lobby. And the university I was in at that time, which boasts as its only US president graduate, I'll let you guess what university and what president that was. That university, there was a huge alumni coalition that had gotten together asking, when that American Rifleman piece came out, to fire me, to have me removed from my job. And I was actually very fortunate, I'll tell you that. It was very fortunate because I had only recently gotten tenure at that university. And that whole thing went down, as an aside, on the day my third child was born. So I was taking all this flack, and somehow someone had gotten my mobile phone number. So there were all these irate, cussing individuals that kept on calling my phone over and over again. In fact, in some cases, it was in front of other young scientists. Later on, the calls continued in front of other young scientists who lost the interest to enter into the field. They said, well, why would I do this when I can study cancer, cardiovascular disease? This is just way, way too difficult. What did I do to contend with that? I think initially, I think there was a lot of fear. I wasn't sure, like, who's watching you? Like, if they can get all this information about you and your family and repeat it back to you over the phone or online, like, what are who's watching you? So it was very concerning. But after that all got through, and after the president of the university, who I have great respect for, said, absolutely not, we're not going to fire this person, not just because we're going to uphold tenure, but because it's the wrong thing to do. We're simply not going to do that. So I have great respect for her and the University of Pennsylvania and following through on that. And that speaks to the need for these leaders at universities to follow through, people like Dean Bowman and Vice President Cunningham here at the University of Michigan, to really step up and build the context that allows this kind of work to happen. And then, to your initial question, to sustain it. And to bring us together to make more of a connection to communities that perhaps we were already connecting to, but then to also think about communities that we haven't connected to enough that might not hold us in the highest esteem. So that is one of the things I learned from that experience, is then to reach out to gun rights organizations and to begin to think about what are our common conversations that we can have and bring this together to something fruitful. Nobody wants a child to be shot with a firearm. Nobody wants gun violence to enter into their communities, and that's on all sides of the aisle. So that's part of the conversation, that trying to make the best out of bad situations that have occurred in the past.
I'd love to stay under this tent. I had a great conversation about credible messengers, and Brandon mentioned the same thing. How are you creating trust in the science that you're doing and the efforts that you're doing so that you can speak to as many different audiences? And I'll open that up to anybody.
So how are we bringing credible messengers into all of this?
Sure.
So when I think of credible messengers, I think of individuals who, frankly, have experienced gun violence in many, many different ways. And the importance, the critical importance of asking them for their wisdom in this. I think there were some comments about photo voice before, and I'll just keep talking for one more second. I'll say that, some of the earliest ideas we had about how to engage community, it was challenging. It was challenging to get academics to simply ask the community. What did they think? What did finding those credible messengers and asking them? We know that you're living in communities and neighborhoods, by the way, both rural communities and major cities, who are equally affected by gun violence, but asking them, what do they think are the solutions that they would do? And this led to a number of unexpected responses that led to entire lines of research funded by the federal government that have since allowed many different programs around the very basic things: housing, access to green space, access to healthcare, these sorts of things that actually have a major impact on gun violence prevention in local communities. And those began with conversations and simply some simple questions of asking community members and those affected what they would do.
Well, first and foremost, we just hired them. At the sheriff's office, we hired a street outreach team, and a lot of folks were like, wait, why would you hire folks with this lived experience from at a sheriff's office? And it was partly because we didn't need people to be informants, right? We needed experts on community. And I will just say, from a research perspective, their experiences should be compensated. And so we literally put our money where our mouth was and started hiring people and professionalizing what their experiences are. So we started out with just part-time outreach workers, and now we have full-time outreach workers and a coordinator. And so I think it's really, really important that it isn't just kind of research from the outside and some laboratory in a particular community. We're talking about people's lives. Yep. And so how do we lift them up and do it in an equitable way and compensate them for sharing their stories? There are many, many times I've been to many, many conferences where you have this person with just a tremendous story, like we heard earlier, and individuals are willing to share that for the betterment to move the cause forward. I literally have staff who would do this work for free. And sometimes we take advantage of all of that passion and vigor to do this work. And we really just need to stay focused on, no, these are individuals who have an expertise to bring. I've met a lot of very brilliant people in this room today. And there are some brilliant people on our streets that through their experiences know how to change an entire society and an entire community if we were only able to invest in them. And so for me, I think that's a part of it, just kind of keeping in that mindset. If we're talking about really, really important, beautiful, beneficial contributions to the science of this work that is in our streets and in our neighborhoods as well.
Yeah, and then, speaking to Derrick's comment, but then also Dora's comment earlier about the importance of co-creating programs, interventions, and eventual evaluation of these programs and interventions is, I think, paramount to equitable research and then disseminating that because you already have something jointly created that all parties involved are supportive of and can promote through their own channels. And then something else to recognize is that a lot of times communities are already doing so much work on the ground. There are so many programs that are totally absent of any research input. That's totally fine. But it would also be great to be able to bring some research evaluation into the wonderful work that communities are already doing. So that's another opportunity for kind of reversing the paradigm of having communities totally create something and then come in and research, evaluate what they're doing so that if found successful, you can really disseminate it more widely.
So I feel I have 1,000 things to say around this. I'll try to be brief. So how do we bring credible messengers? I think the reasoning behind it is really we need to know where they're coming from and what shapes the behavior, and with that understanding, we could have better message. We could identify the right person to convey that message. And I just feel so privileged. I'm going to say this out loud. I also, as a junior faculty in this field, especially in firearm research, I'm privileged to have role models in this field, in community engagement, in working with credible messengers. Professor Alison Miller sitting right there is one example of my role model doing this work for a long, long, long time, and also doing awesome work. So I think learning from her model of really engaged community members in the family settings, in the community, is really helping me to think deeply how we could do this work together. And with dedication, with the presence, and with the community partners, with each step, including our community member in the process. So just want to say thank you, Dr. Alison Miller.
We have a whole room full of folks that are engaging in this space. Still, one more question on this tent. Are there voices that you think we are missing that we need to prioritize to make sure that they're around the table? Please, or Derrick.
So I'll chime in on this. I just thinking to myself, and just in the work that I do around law enforcement, I know sometimes there's this need to try and build up these walls and keep police out of some of these conversations. And I think what we need to do is to be able to have everybody under the tent. I think there's some really important conversations. And I didn't say this towards your first question, but as I was thinking about the question, I think about some of the rural areas. I know there are certain things that I wish we could do in more urban areas, right? Like I wish our kids learned how to be safe with firearms. We take it for granted in certain communities when we learn how to hunt and shoot. And so when I start thinking about like how we pull people together around these really, really difficult topics, there are some things that could actually unite us that we just take for granted. And so when you think about who needs to be around the table, you said it earlier, I think everyone needs to be around the table. It isn't just something that's happening because there's interpersonal street level violence in one place or suicides in another place. We started looking at some of our data from an epidemiological perspective. And what we looked at was all of our shooters in our county that we had looked at. When we looked back at their history, a lot of them, not all of them, a lot of them had significant history of domestic violence in their households when they were kids, or serious aggravated assaults that were going on when they were kids. So in some research areas that isn't necessarily directly that at that moment that might not make sense, it really brings you into the tent. So when I just think about like all of these issues, to me, there's almost like an octopus. There are all these things that spin off of oppression and poverty and racism that we start seeing around interpersonal level violence. And so how do we get everybody to the table talking about these issues? I think it's an important concept to think. And I don't think that there is any one person or any one group that has a monopoly on what this really feels like. And sometimes it's hard from a community perspective. I'll just kind of end with this. It's hard sometimes for us in community to sit there and have researchers or folks who don't look like us come into our neighborhoods and have these great ideas. And I think it's contingent on all of us. You can't have a relationship if I extend my hand and you look me up and down, right? Like it takes two people to extend a hand, both community and the research institutions. And so I think it's a two-way street in kind of building out that tent.
And I'll also add that I think we've been doing a better and better job of making sure we are including multiple voices at tables. And I'll say tables plural because sometimes it does seem like our conversations can be a bit isolated from each other. So, maybe we have public health and medicine over here, social sciences over there, criminology over here, community work over there, and there is intentional work in bringing all of those tables together, and I think we can still do more to bring all of the conversations that people are having together so we can really all build off of each other's efforts rather than replicate and duplicate them over and over. And I think there's a more efficient way to do it and a more equitable way to do it that we're working towards.
Wait, can I add to that?
Yeah, please.
So I have to say, in years of working with communities, I'm always incredibly heartened that folks would step forward and even have a conversation and take an interest and be so passionate, and they should be reimbursed for their work. But I'm always also concerned that there are voices that never even show up to those meetings that we don't seek. And we need to do a better job of finding those folks who effectively, I don't know, maybe they're introverted perhaps, or more so that they simply don't want to be detected in the first place. There's a lot of wisdom in them as well, and we need to bring them to the table. And I don't think we do that, if ever. And there should be an additional bit of work to be certain that we find those people as well, not just folks who show up or the loudest voice in the room. It's got to be folks, perhaps, find the person in the room, the person who's not even in the room, or the person in the room who hasn't said a thing, and ask them what they think. I think that's equally important.
That's such a great point, and I just want to add a little bit to that, is that also recognize there's such a diverse voice within one community too, and recognizing there's diversity within a community. For example, think about Asian Americans. We tend to be grouped together, but then you see how many different ethnicity groups can be grouped together within just being called Asian Americans. Really allowing this diverse voice to come into you in different ways, in different channels, in different, using different questions to prompt that is important.
Excellent, thank you. This next question it's the ultimate public health question. The question is, at which level, individual, family, neighborhood, structural, et cetera, should you be engaging, intervening? I'm not gonna give you that question because I know exactly what the answer is gonna be, but I'm gonna ask you to tell me strategies that you've used to be successful at engaging at these different levels of the socio-ecological model. So if you've been working at the individual level or at the structural level, where have you found success or where have you found some barriers? And again, I can open up to anyone.
I'm not a researcher, but I got lots of thoughts on it.
Let's hear it.
No. So I guess I'll just jump in and say, part of what I've been trying to do is really blend all those worlds together, right? And so, I mentioned the mothers. We have this support group of mothers whose kids are involved in the juvenile justice system. And so they're a support group, but as they learn and develop, again, how do you provide a platform for them to share their stories? And they really influence how we do things from an organizational perspective. Same thing with our community outreach team. They're like the conscience of the sheriff's office, of our organization. So when I think about all these different levels, whether it's individual, community, large organizations, or neighborhoods, we try to blend all those and weave all these things together. And sometimes that's a very messy process, right? It's hard to take someone who's raw and from the streets and hire them at the sheriff's office. Trust me, I've had a whole bunch of landmines blow up. But there's also something beautiful and amazing about seeing like our undersheriff sitting in the same room with someone who did 25 years in prison, and they can literally talk together about these really complex issues around policing. And so a little bit of a different take on it versus from a research perspective, but the ability to intertwine all these different levels together, we've seen some pretty amazing things come out of it.
I'll also add that I think that the role of the arts has a huge part to play in shifting culture, in shifting climate, and has potentially the largest contribution into shifting attitudes and beliefs and norms. And so I think that is something to keep in mind as we're going on these endeavors to try to shift cultures, ideas, beliefs around firearm and firearm violence. Another thing that I think about is when we think of strategies to prevent gun violence, oftentimes we go to the gun and we think about ways that we might legislate around that, or programs, policies, interventions around the gun specifically. And I also remember that social and economic policies and programs are also violence prevention programs. And so, just that can also be at a wider level of the social ecology, thinking about different opportunities to intervene on some of those social and cultural risk factors for violence.
So I think the socio-ecological model, I try not to even say that, to be very honest with you. I think it generates the response that you just had, which is it's so enormous. It's basically everything at some level. So it's not as, it doesn't provide as much guidance as I think academics think it does. So I'll start there. But I will say, as a general thought, we need to have programs that are responsive to gun violence. And those are, prototype programs for those are the medical system and law enforcement. Those are necessary. But I'm going to put my public health hat on as well. We need programs that go as far upstream as possible in contending with this issue. Now, those could be programs around policy and legislation. They also very much could be programs around things that are seemingly unrelated to gun violence. Good housing, access to green space and parks, access to jobs. When you talk to folks in communities, these are the things that they're telling you first. And again, this is, I go back to the comment I made about ask the community, but we need as a public health community to go as far upstream, as an academic community entirely, go as far upstream as possible and begin to think not just about those as abstract relationships and associations, but what solutions are emerging from that? Are there affordable housing solutions? Are there job creation and retraining solutions that we can put and scale up to a lot of different places that are going to be helpful? So that's my thought about it in terms of bigger context, bigger, bolder things than simply waiting for gun violence to happen and then reacting to it.
Yeah, in terms of multi-level thinking, I like to think both at the risk factor way and also the positive factor way, what we call resilience promoted factor way too. So when we think about risk, for example, racism, it can happen at interpersonal level. It can also happen at in a structural level. And at a structural level, there are different ways that it could happen too. So being able to see how they intertwine together is one thing, it's our job. At the same time, I feel like we don't want to just stop there. We want to also look at what positive things can happen at different level, at individual level and family level, at the community level especially, and the policy level too, and those things, how they can work together to counteract what we're facing. So just this is how I've been learning, and this is the thinking that's been guiding me throughout all the projects I've been working on, thanks to my training here.
So I think I heard several references to the policy level, to sort of the structural level. And so thinking again about engaging communities, how are we engaging communities to intervene at, for example, those higher levels, the structural level, the policy levels? Charlie?
It's very difficult, bottom line. And I think a lot of communities will say things like, we want jobs and housing, but will give that to you and say it amongst themselves in the community as like a dream of theirs or something like that. Because they're living in contexts that have denied them these things for so many generations that it's just not something, they'll say it, but it's not something that they think is really going to happen. And I feel like institutions, whether they be universities, government institutions, and so forth, need to do better. Instead of putting Band-Aid solutions on top of things, really need to think about beyond just the administration that's been elected in this particular 4 years, whether that's the president or a mayor, begin to think beyond their administration about things that they're going to put in place that are going to be long-lasting and are going to transcend generations. And do it despite the fact that it's not going to win them votes in many different things, in some sort of short-term way. So I think it's quite challenging, and for us to step in and try to, as university and as scientists, to try to put some numbers behind the value of these sorts of programs to the extent that we can. And that science lasts, by the way. That science will be in place for generations to come, for folks to point back to it and say, well, you know, this really does actually work, and perhaps at any given moment someone will be opposed to it, but it'll be there 10 and 20 years from now for someone to revisit it.
Yeah, you know, we just released, we're slowly but surely, I mentioned the epidemiologist we hired who's looking at all of our data, and we're doing these grand rounds, and the first 3 grand rounds we did were with a room full of folks like they're in here today, and then we did it with community members. And one of the things I just wanted to add to this is don't underestimate how sophisticated folks who are in certain environments are around these very topics, right? There were things that I didn't necessarily know scientifically as a kid who grew up in this environment, but I was an expert at navigating the environment. And so as soon as I seen the data that pointed to why I responded this way, it made the connection, and now it all made sense very, very clearly. And so I know when we just did the grand rounds with community violence intervention team, they were fascinated by it. So all the data and report out that we couldn't even get through the entire presentation. We got to have a second meeting to talk about it because they were quick to take the data and make it make sense in realistic, kind of real life pieces that I just wanted to put that out there. Like, we shouldn't underestimate the sophistication of the individuals that we're studying and researching and talking about, because again, these are people's lives who may speak a different language around some of this, but once you help them see it. So my biggest point is, I think we should really be taking this stuff to the people and elevating and giving them the platform. Like, what would you do with this data? That's what we just did in the last couple of meetings, and it's fascinating how we thought about the data versus how community members are thinking about how this is really relevant to them.
Rebeccah or Hsing-Fang, anything to add?
Yeah, just kind of echoing some of the comments already said, from my experience, it takes a lot of work and a lot of time and a lot of intention to do this. It's not something that's just going to happen on its own. Yeah, I think that's all I have to say.
I just really want to echo this point that Officer Jackson pointed out. When we look at data, it really is just aggregated number. So we see part of the story, but not the whole story. And so there's another angle. I think we need community member and experts in the community to help us understand what we're missing when we look at the aggregated data, right? So talking to them, using interviews, focus group, using meetings or data party that Dr. Daniel Lee talked about yesterday with community members to bring what we learn from them back to them and really engage the conversation with them and learn from them how to make sense of the data. What are we missing here? How do we translate this into action? So that really is my learning process here to be working with community member, is that how do we not only value their voice, but also with their help translate their voice into action, into our research, into the intervention building. That is how I see works here.
I love these points, and I wonder if I can push folks to just expand a little bit. I mean, we have this very interesting set of roles here with either from the Sheriff's Department or university, and I think about Celeste and Moms Demand Action and Cal Evans, who's working in Detroit. You know, if these organizations are making a push to affect change, what are some other ways that we can take our particular expertise and support those missions that are not, I mean, maybe in addition to data, which I love, but what else can we bring to the table to help them?
You know, last night we were talking around dinner, and for me, there were certain things that we're in the field doing the work, hands-on. There are things you just don't know that you might miss because your head is down of what's going on that's really, really good around the country that some of you are just researching and evaluating. And so I think one of the first pieces could just be that, right? Like the ability to shed light and kind of lift people's heads up who's like head down doing the work on, here's what else is happening around the country. And we might take that for granted and think, well, people can sit down and kind of do this research on their own. But literally, my day-to-day job is these kinds of real life situations. And so the ability to sit there and think deeply around the research and who's doing what here and what the science is telling us, don't always have the opportunity to do that. So I think one thing is that you all have access. You all have knowledge. You all have the experience from seeing this from a larger global perspective, and how might that be shared kind of operationally with the folks who are doing the work every day is a little bit different than just doing the research. It's a two-way street, right? Like us learning from you to really enhance what we're doing. And I'll say again, because we run into this, we don't always have the answers operationally. We may think we do because of our lived experience, and so this feels right. But sometimes what feels right is not actually moving the needle. And I've reached this point, we talk about it amongst our team, if it's not moving the needle, we're wasting our time, right? And so some of the things that you can help us really see is, all right, this may feel right, and maybe there's some good coming from it, but is it really moving the needle and impacting change in the way that you ultimately want to impact change? And so calling that into question can be a difficult conversation, but I think that's that conflict that could be good conflict to make sure we're not wasting our time and people are really making the change that they want to see.
And I also think there's a really big place here for relationship building between community members, between researchers and community members, between researchers, community members, practitioners, and so much happens in those transactional and in those relationships. And so the more we can build this network, build relationships, strengthen those relationships, I think that's when we can start to see more efficiency in our work, and again, bringing all of the voices to the table rather than having all of these separate, distinct tables.
Please.
So I wasn't sure who the we was in your question. I'm just going to answer on behalf of, or my thoughts are on behalf of universities and the biomedical structures in many cities around the nation. There's a great book, came out a couple years ago, a guy at Trinity College wrote, called In the Shadow of the Ivory Tower. I'd encourage you all to look that book up. In it, there's a great argument about what is the role of our, quote, eds and meds around the nation. Our major educational institutions and our major medical institutions. In fact, in most cities around the nation, these are the top employers in their local cities. They employ more people. In my city, Columbia University and NYU hold more real estate in the city of New York than anybody else combined, right? So there's amazing wealth and resources, and I think one of the things that could be returned are those resources to the local communities that many of these institutions find themselves in, very directly. And I think we haven't really had those conversations. There's some emerging conversations being had. Healthcare executives and major health systems around the nation have gotten together to begin to open this dialogue and make these investments in gun violence prevention for their local communities. There's a couple of great examples. University of Pennsylvania is one of those examples. Columbus Children's Hospital in Columbus, Ohio is another great example of direct investments in things like housing and green space creation in their surrounding communities, coming right out of their budgets for their local communities, which have been very hard hit by gun violence. We need much more of that. We need more models like that. Now, those are really institutions, the investments coming out of the medical institutions. I haven't seen nearly as much from a coalition of universities around the nation doing the same thing. And I'd love to see more of that in this space. So that's in answer to what I think your we is, that's what I think we should be doing more of.
Totally agree, and it really got me thinking, and it has been got me thinking, is I think community engagement is a long-term commitment. And very frankly, as researcher, we also work with short-lived projects. And what happens after the project? And I don't have perfect answer here, and I will invite everyone to think with us, with me, how do we keep the commitment going? Because it's so important. It shouldn't be ignored that after the project ends, and committee members sometimes left with no funding, and us left with no funding, then what can we do together to keep the work going and ensure the sustainability? And that is really the tough question. I think the next step, and with the wisdom here in the room, something we can figure out together.
Great. Several questions around best practices, evidence-based strategies, particularly those that do engage community members. I'm wondering if anybody would like to talk about some of the strategies they've employed or some of the evidence-based or promising practices that they've seen effective in terms of preventing gun violence in the community. You know, community can be widely defined.
Well, in the spirit of going upstream, our group and with the group here at the University of Michigan had done a decent amount of work on changing some of those basic structures in communities with communities, actually at the initiation, as I was saying before, of community members, and that was around green space creation and housing fixes, housing and abandoned building fixes in many cities, and both with the community's ideas, taking those, but then applying the highest level of science to those, we found very significant and sustained reductions in gun violence in communities where these investments are made. Now, there's a number of cities that have taken that up, these sorts of things up around the nation, but not nearly enough. And I think if we could get more of those sorts of best practices and getting more communities to think about these far upstream interventions, and not simply transplanting what was done in Philadelphia or New Orleans to another city, but thinking about the idea of these interventions and how they could adapt them to their particular city or town. I think it could be really, really powerful to get more cities to invest in that.
So I do got an answer for this one. So I reached out to our community engagement core director, Dr. Cindy Foster. What's the wisdom you have for us for community engagement? And I'd like to quote her here. She said, "Curiosity, humble, and kind." And I think I totally agree with her. That's 100% what we could apply here for community engagement. And I would add one thing that is truthfulness. Be truthfulness about, be honest about what you're trying to do with them, and bring your struggle with them, listen to their struggle, and really share the mutual truthfulness throughout the process. I don't know if it's the best practice, but I think it's a principle of working with them.
Adding to Hsing-Fang's point, the transparency should be a huge piece of this community engagement process, and transparency about, how are we going to co-create this? How are we going to co-evaluate it, or are we going to co-evaluate it? And also, to a point raised earlier, what's going to happen when this project is done? How are we going to end this relationship on good terms, or how are we going to continue it onto the next project, the next idea? So that's just, another piece of what I think about when I'm thinking about how to engage communities and work alongside communities in this work.
Rebecca, you gave me the segue. The question was asked. It's not just me. Evaluation. I love it. I love thinking about it. I love it as we're trying to develop these best practices. We're trying to establish this evidence base. There was also a question I thought that was really interesting around needs assessments. So thinking about how we can engage in some of those practices like needs assessment, evaluation, process evaluation, engaging community members. Where do you see opportunities? Where do you see challenges? And I'll stop.
Through my training, I'm primed to think about evaluation in a very specific sense, and that's not always how my community partners think about evaluation. So I think that's an early and often conversation to think about, what do you see as success of this program? What kind of data do you want to gather to evaluate the success of this program. And then, what are we going to do with the findings? And so that's, things to be thinking about in this evaluation process. And again, just reminding myself that my ideas of evaluation are often much different from those of the community partners.
So I'm reflecting, I'm looking at the person from Moms Demand. I love when the red shirts show up to events, so it's always a joy. And so she had said before that she wasn't a numbers person, right? Am I correct on that, right? So my background is in mathematics, and I'm not a stories person. And I kind of feel like that's fine in both directions, but bringing those people together, I think I talk to my trainees this way about the importance of what we call mixed methods. That really any study as an epidemiologist, we can do the fanciest numerical study and the numbers remain in the stratosphere, even with the best interest of the community and with the community co-creation at the beginning of that. There are numbers that are created that needs to be brought back down to earth with stories, and those stories and how it worked. Just because the numbers showed that something worked or was successful, even if the community suggested it in the first place, we still then need to come back and figure out, well, how did it work? And because that's part of good science, to be quite honest with you. Simply reporting the numbers doesn't demonstrate what epidemiologists call causality. You need to have a mechanism around that, and that just doesn't work without being on the ground and asking people, well, we found this, but what do you think happened here? I know the numbers are saying this. How did this actually play out? And then bringing it back into the community for extensive. And do you then think this is worth scaling up in your community from there? But that kind of mixed methods thinking, I think, is critical to evaluation. And we stay in our silos. We are either numbers people or qualitative and narrative people, and rarely do we ever meet. And we need to get together much more often on this.
Thoughts?
So challenges and opportunities. So one challenge I think we're constantly facing, and in the school safety community too, is that, and also in a lot of community partners that we work with, is that the competing priority within the organization, that they already have so many different things that's so important for them to do, and then yet again one more. So how do we work with them and really bring what we can bring on the table, and help them work through that competing priority is one thing we could do. And in terms of opportunity, one thing came to my mind is that I also see that a lot of community members feel enormously happy when they know what they're doing with us is making a difference. Mm-hmm. And so let's speak to the importance of bringing what we learn from them back to them and show them that we're taking action. So I think that's the opportunity we can keep building on, and then strengthen the relationship moving forward.
Yeah, the only thing that really was coming to mind for me, I'm just thinking back to all the different times I've had either researchers come to some of the programs or evaluate folks, evaluate some of the stuff that we're doing. And relationship, I think, is important. That it isn't just about, you said this earlier, not just about the numbers at the end of the day, but people who really came to the table and were genuinely a part of the conversation. And, sometimes you just got to be the fly on the wall, observing what's going on as you're doing your work. But I think being there and being genuine and being a part of the conversation, and sometimes I feel like I'm a translator, right? I'm in between all these different worlds, and I help, folks kind of speak to one another. And I think being able to be in the room and being part of the conversation is just something that keeps jumping out to me around this question, is like, how do we do that? How do we make sure that we're genuine and we're a part of the discussion and a part of community, not just an outsider who comes in for a small period of time, does our work, and then vanishes? Even if that work is good at the end of the day, how do we still maintain those relationships moving forward? I think is something that's really important.
Derrick, if I could build off that point, I mean, one of these questions is around when there are mistakes that researchers or allied folks and physicians of authority can make when trying to engage communities, and how do you restore or repair some of those mistakes? And I mean, helicopter research is one of those things that often gets cited, but I'm curious if folks have advice for researchers, if there are things to avoid, but then also if there is a mistake, what can we do to repair?
Again, I'm not a researcher, but I'm just thinking about it from kind of an official standpoint in my job. Like, how do you repair the harm that might have been done? It's an ongoing process. Something that happens today and you've made all this good work, something happens for us 1,000 miles away, and guess what? You take 5 steps backwards. And so there may be some good work that happens, and maybe there's one meeting where something goes sideways, and then you kind of erode that trust. But trust is a constant battle and a constant movement. It's not something that just stays stagnant, right? And so it is about continuously pushing forward on a regular basis. And this is what I mean, again, to my last answer around the relationship. I think this is where relationship is important. Trust comes from 3 things. Relationship, it's about competency, and it's about follow through. And so if you can come to the table with those 3 things, I think you have the ability to build trust and maintain it over time. And if you have that relationship and you make a mistake, and I'm looking at you, but I know who you really are, even though you made a mistake that I disagree with, that trust still maintains, right? And so I think that's the piece of, like, how do we stay in relationship with one another?
Amen, and we try again. We'll meet again and talk it over a second time or a third or a fourth time. I think that's right.
Mm-hmm.
So the next question is around sort of calls to action. I think this is an interesting one. Calls to action for community members around these solutions. How are we getting the information that we are developing here on campus out? What does that outreach look like? How can we begin to translate, whatever it might be? How do we make that voice as loud and clear as possible?
I think the call to action might operate in the opposite direction, where the call to action is actually stemming from communities, and we as researchers need to hear it. I think back to the quote you said earlier about the people who are closest to the problem are often closest to the solution, but way too often furthest away from the power to do anything about that. So I try to challenge myself into hearing the calls to action that I'm hearing from the community.
I think some of it is just to show up. I'm right here in Washtenaw County, where the University of Michigan is, and we're always eager and excited to have the interactions with folks who are in this room. But oftentimes in a place like Washtenaw County, we get overlooked. Like, we're relatively safe compared to a Detroit, a Flint, a Grand Rapids, but there's still so much great learning that can happen here and so much need that can happen here. I have this book. These are real names that are in here of people who are losing their lives as we fight this battle. And so I think just being present is one thing, but also just to know, particularly here at the University of Michigan, like, there's a lot of things right around this campus. I have kids who every Saturday on a football Saturday who live 6 miles away who root for this university but have never stepped foot on this campus. And there's so much to say about that, right? And so me, as someone who went here, who does the work in the neighborhoods, I get to see all of that excitement about what, and this is not just an indictment on or the University of Michigan, but it's just the world that I know, on the Block M, but yet a disconnect from 6 miles away, and how might we bridge that gap? And so how might we make partnership and just be a part and listen to what community is really saying? There's so much passion right now, at the federal level, putting money into community violence intervention. At the state level, even in Washtenaw County, we put millions of dollars into this work. And so it is a great opportunity right now. And people are coming out of the woodwork to be a part of this conversation. How do we make sure we hear the people who are most impacted by the problem and really listen to them, I think is an important concept.
I don't think we fully embrace a complete bilaterality. I think a lot of the comments and a lot of the things we do are all about, any grant proposals have a little time, outreach, right? That's an outreach core doing, but it can't be simply outreach, it's got to also be inreach. And I think your point about the kids who live 6 miles away, who cheer for the team here, who've never set foot on campus, that's a problem. So there's got to be inreach, and you have to provide, I think, real, and this isn't just about Michigan, this is about many different institutions, have to provide real opportunities for inreach, for those kids to come to campus, and not simply for, for something short term, and then they leave and don't come back again. Provide them pathways to education here. Provide opportunities for them, real opportunities for them to engage with the campus and be part of your scientific studies here on campus or something, to learn from and be part of your scientific team on this campus or something along those lines. Give them real chances to engage with the campus, not simply show up in their community, but bring them to your community as well. So outreach and inreach, and I think we need a bit more of complete bilaterality in this.
We are down to just our last couple of minutes in our last panel for the day. This was called Build a Big Tent, Community Engagement Solutions to Gun Violence. Closing thoughts. Hsing-Fang, we'll start with you. If you want these folks in the audience watching at home to know one thing about this topic, what would you say?
Sure. So the story that was shared this morning by Brendan and how he was talking about a sense of safety and belonging really sit in me. And I think as a society and with the community, we cannot be successful without having each single of us to feel that way, to feel that sense of safety, to feel that sense of belonging. And I think community engagement is a great channel to make that happen, because only through all of us working on that, we can each feel that way. So that's how I feel.
Derrick, closing thoughts?
Yeah, I don't think community engagement is a program. I don't think it's just a feel-good thing that you do once or twice. I think it is a way that you think about the world. I think it's a way that you think about the work that you're trying to do. And so if there's just one piece I would leave is that paradigm shift, that it isn't just a program or a quick idea. It's really about the way we ingratiate ourselves and be a part of community, not just as researcher or police officer who happens to work in community, but literally being ingrained in a part of the fabric of community. And I think it's a little bit of a different way to think about community engagement.
The work of preventing firearm injuries, whether it be on the research side or the community work side or a policy side, it can be really tough work. It can be tough physically, emotionally, mentally, socially. And so I also see community engagement as an opportunity to potentially provide a healing framework, a sense of belonging, a sense of community, even within this practice of community engagement, and an opportunity to really find joy in work that could otherwise be really tough. So that opportunity to find joy, I hold on to it whenever it comes along, and I think something that community engagement can really offer.
Thank you. Charlie.
So I'll build on the joy comment. I think that we focus too much on the problem. And I think perhaps this was stated early on that we talk so much about the problem that it sometimes can generate a sense of hopelessness. And my hope is that we can then turn that around and not simply talk about the problem needs to be identified and documented, but what hopeful things, what solutions, bold solutions can be co-created, co-initiated with communities that can generate long-term excitement about the possibility of a different future. I think that would be really important.
Folks, I got 2 words to say about this panel right here. Anybody guess? Go Blue. Thank you so much, everyone. It was wonderful to hear your perspectives.